Okay, so we're gonna talk about colonic diverticulitis in this part. Okay, and moving to the introductions part of colonic diverticulitis. So here we have colonic diverticulitis is a condition that occurs when small pouches diverticula that have developed in the colons become inflamed or infected. So basically, here we can see in the images that here we have a large intestine, that is a colonic part, and here we have ascending, transverse and descending colon. Similarly, here we have sigmoid colon. Okay, and we can see here in the wall of colon that it get diverted, or it here pouches has been created in the wall of uh, colon. Okay, so as we have seen in the introductions that colonic diverticulitis is a condition that occurs when small pouches or diverticula that has been developed in the colon, okay, and becomes inflamed or infected. So these pouches leads further to inflammations, infections, and then inflammations. As food particles get digested food get trapped here in the, or we can say uh, inserted here in the pouches, which further cause the inflammation, okay, infections and then inflammation. Now talking about the causes of colonic diverticulitis, the very first one is like low fiber diet. Okay, so if we are having less amounts of fiber diets, it means decreased amounts of vegetables, fruits, okay, which is the cause for colonic diverticulitis. Okay, a diet low in fibers can lead to increased pressures in the colon during bowel movements, okay, which may contribute to the formations of diverticula. Oh. Now the next cause is age. So in the risk of developing diverticulitis increases with age. Okay, now the third cause is genetics. So there may be a genetic predispositions to developing diverticulitis. Okay, now moving further, we let us talk about its symptoms. That colonic diverticulitis can show different symptoms like abdominal pain, okay, particularly in the left side of, so why left side? It can colonic diverticulitis can be occurs anywhere or any parts of the colon, but we are but the here it is written that particularly in the lower left side. So it is because the colon, a special part, that is a specific part, that is sigmoid colon, it's mainly affected, okay, during colonic diverticulitis. So it is here it is written that particularly in the lower left side of the lower left side of the abdomen we have abdominal pain. Okay, now the next is fevers and chill, and nausea and vomitings. Similarly, change in bowel habits, okay, bloatings and gas can be created. Also rectal bleeding, as there is infections, inflammations due to or also the different abscesses are formed, which leads to injury of the wall of the colon, and which further leads to rectal bleeding. Okay, now talking about the diagnosis. So what are the diagnosis? We can So diagnosis of colonic diverticulitis often involves a physical examinations, medical history review, and may includes the tests such as CT scans, ultrasounds, okay. And also a very important diagnostic test for the colonic diverticulitis is uh, colonoscopy, okay. Colonoscopy, colonoscopy, okay. So colonoscopy is very important diagnostic test for colonic diverticulitis. So uh, uh, camera, okay, inserted through the tube in the colon, okay, through the anus part, uh, and easily we can see that whether there is any abscess forms in wall of colon, or we can say any inflammations occurring in the wall of colon, okay. Now let us talk about the treatments. So treatments may involve antibiotics, okay. If the conditions is mild, antibiotics may be prescribed to treat infections, okay. So as there is infections occurring in the wall of colon, so for the infections we use antibiotics. Then as the abdominal pains are there, for which we have to manage the pain, okay, medications may be given to reduce pain and discomfort, okay. Now dietary changes, increasing the fiber intakes and avoiding certain foods, that helps prevent for futures flares up, okay. Similarly, in severe cases, hospitalization, surgery may be necessary to drain abscess, okay, or remove affected parts of colon, okay. So here we end uh, our topic today, and thank you so much. You can like, subscribe to our channel, Lifetime Reader, okay. Thank you so much.